All right, today we are going to chat about Retatrutide, Retatrutide. And this is a third generation weight loss medication, right? That will help you lose weight very, very quickly and very efficiently. Everybody knows about Ozempic and Wegovy, right? Those were first generation weight loss meds, and the generic for that was semaglutide, Semaglutide. And this was the original GLP-1 agonist. And what it did is it reduced appetite, it slowed gastric emptying, and it stimulated insulin release. And these three key variables allowed people to lose significant weight. It was great for burning fat. If you went on a high protein, low calorie diet, if you exercise more, and you put a little effort into things, you can lose a lot of weight with semaglutide. But again, it is just a GLP-1 agonist. The second generation weight loss medicine was tirzepatide, Tirzepatide, also known by brand name as Mounjaro and Zepbound. And this medication not only worked at the GLP-1 site as semaglutide did, but it also worked at the GIP receptor, right? And that's the glucose dependent insulinotropic polypeptide receptors. And what these did is they enhanced insulin secretion and they improved fat metabolism, meaning they helped your body to burn down fat when you were on a high protein, low carb diet. And that medicine, tirzepatide, worked a little better than semaglutide and had less side effects. Well, the new one, folks, retatrutide, works at three receptors. It works at the same receptor as semaglutide. It works at the same two receptors as tirzepatide, and it works at an additional receptor called a called a glucagon, Glucagon receptor, where it is a glucagon agonist. And what this does is it helps the body to break down fat as an energy source when you're on a high protein, low carbohydrate diet. They are expecting this medication to be released in 2026, folks, and this will be a game changer. A lot of the preliminary data shows that you can lose a lot of weight with this medicine. So you want to do it with a high protein, low carb diet. You want to exercise, and you want to obviously try to keep your calorie count down when you're on this medicine for weight loss. And, some of the preliminary data shows that over a 48-week period, people were losing up to 24.2% of their total body weight. Now, I do weight loss in my clinic, and we probably average 7 to 10 pounds per month with most of my patients. But the patient has a role in how good they go on how much weight they lose. If they're willing to exercise, if they're willing to eat a ketone type diet, an Atkins style diet, they will lose weight rather quickly. And also, the weight loss is important, but you also need to exercise and do weight resistance training to help maintain your muscle mass when you're on these diets. And if you have a problem with your liver, like fatty liver disease, these medicines will help the liver recover and get rid of the extra fat that's causing the problem. With people who have fatty liver disease. These drugs also lower your risk for stroke. They lower your risk for heart attack. They help prevent cognitive dysfunction. They help with diabetes. They help with heart disease. These medicines, in my opinion, aren't just weight loss medicines. They are anti-aging medications. So again, retatrutide isn't out yet. It's still being evaluated. And there really is no dosing guidelines yet, but from what I have read, it looks like the proper starting dose for retatrutide will be 1 milligrams subcutaneously once a week. And I think on that dose, if you adhere to the proper diet and you exercise, you're going to lose a lot of weight. And then, if you notice that the weight isn't coming off as quickly as you would like it to after a few weeks on the medication, you can bump it up to 2 milligrams and then increase it as per your doctor's guidance. Now, remember, folks, I am a family physician, but I'm not your physician. So everything here is for entertainment and education only. If you need medical care, talk to your doctor. Again, I am not providing medical recommendations here. It's all just for entertainment and education. So I think retatrutide is going to be a game changer. I mean, there's no doubt that semaglutide has been a game changer. Tirzepatide has been a game changer. But Retatrutide, folks, this one is going to really, really help folks to lose weight and to get healthier. Remember, folks, your life is your choice. If you want to live a healthier life, if you want to live a longer life, then you need to take steps to make that happen. And how do you do it? Well, you lose body fat, you get rid of visceral fat, you exercise regularly, you don't smoke, you get active, and you try to keep your stress levels down. So if you like the video, folks, hit the like button, subscribe to my channel. I'll be back at you soon with another video. Have a good day.